I'd like to welcome you to a Speak Sooner community education program. And this evening, we will present There's Not Enough Time. What can patients and healthcare providers do about it? I'm Bernard Bandman, Executive Director of the Center for Communication in Medicine, based in Bennington, Vermont, and I will be your moderator. The mission of Speak Sooner is to prepare patients facing serious illness and their family for honest and timely conversations with healthcare providers, leading to decisions about care that honor a person's values, priorities, and goals. Before we meet our panel, I'd like to take a moment to thank our sponsors who made it possible to present this Speak Sooner program. Our lead sponsors are Adirondack Health, Halcyon Foundation, Bennington Potters, Kathleen Blatz and G.R. Page, Brent Caulfield, DDS, Concy West, Dr. Robert and Alice Peslich, DePaula Auto Group, M&T Bank Foundation, and Vanderbilt Communications. And our six signature sponsors include someone anonymous, Frank Bass, Jan Bassman and David Brown, D.B. McKenna and Company, Dr. Sarah Dahl and Dr. Charles Salem, R.K. Miles, Victor Lewin Jr., Dr. Carol Salazar, and the Winburn Law Office. And now I'd like to introduce the panelists. Dr. Michael Welther received his MD degree from the University of Wisconsin and completed a residency in family medicine at the University of Arizona. Dr. Welther worked as a primary care physician in Arlington, Vermont for over 35 years, having founded Arlington Family Practice. He is currently retired and serves as board president of the Center for Communication in Medicine. Colonel James Baker is with us to share his experience as a patient. He served with the Vermont State Police for over 30 years and was director from 2006 to 2009, before working as an independent consultant for numerous federal law enforcement agencies. Currently, he offers services in leadership coaching, first responder safety and wellness, and law enforcement executive searches. Jessica Garnsey is a cardiology physician assistant at Adirondack Medical Center in Saranac Lake, New York, with a certificate in palliative care and serious illness from CSU Shirley Haynes Institute for Palliative Care. Her clinical interests include heart failure management and palliative care. She lives in Saranac Lake, New York, with her husband and black lab, Nora. Jenny Coombs is 55 years old and has been battling breast cancer for 8 years. Her first diagnosis was in 2018, with recurrences in 2019, 22, and most recently in 2025. She has an amazing husband of 32 years and 2 beautiful children, Nicholas and Kaylee. This has been a very difficult journey, but she remains positive. Jenny has a great team at Dartmouth Hitchcock Medical Center. She's doing her best to live in the moment and celebrate every milestone along the way. And now I'd like to introduce you to those who we interviewed on video. Dr. Mary Chamberlain is an oncologist and director of the breast cancer program at Dartmouth Health in Lebanon, New Hampshire. Dr. Chamberlain is an associate professor at the Geisel School of Medicine at Dartmouth. She attended the University of Vermont College of Medicine and completed her residency at Fletcher Allen Healthcare in Burlington, Vermont. Full disclosure, Jenny is Dr. Chamberlain's patient. Kevin Daly is a cardiology patient. He recently retired as an administrator at Southwestern Vermont Healthcare in Bennington, Vermont. Kevin holds a JD degree and has a long history of community involvement, having served on numerous area boards and committees in the town of Arlington, Vermont. So just before we begin, just a reminder that we'll be taking questions throughout the program, and you can submit your question to the form you receive with the link to this webinar or online through the Q&A on your screen, and we'll answer as many questions as time allows. Now, let's move into the topic of this evening's program. And we're going to begin by viewing a video that will set the stage for our panel discussion. So let's take a look.
Interestingly, we used to be 15-minute appointments, and then we expanded it to 20. But in the process, it seems like we have even less time. And I think that time issue is getting worse and worse, especially since electronic medical records. There's just so much volume of stuff that goes into electronic medical record. And even though it carries over visit to visit, you still have to review it. So the best way that I found to keep time management working well is to have a good medical assistant who can start the process even before I come into the room. And then, especially with some complicated patients, even before the start of the day, we might just sit down and, quote, huddle for a few minutes to discuss where we might want to go with the patient. So setting aside the acute visits, which are quick and short and one issue at a time, most of the problems occur in chronic care. And we have to juggle sometimes multiple problems. Even if somebody comes in with diabetes, you still have to consider heart issues, kidney, lungs, skin, neurological. So there's multiple directions you have to go, and you need to kind of have it prioritized.
As a physician assistant in a cardiology practice, and I don't think this is unique to cardiology at all, but it really comes down to a supply and demand mismatch in a way. You know, there's a huge demand on our time, and the supply is very limited. And I think that is really what a lot of the challenges for me boil down to. We're constrained in terms of the amounts of time we have per visit. And we also have these other demands on our time, whether it is a nurse, pulling us aside to say, oh, did you read that urgent message? The lab calling with a critical result, or the ER calling with a consult. It just seems like oftentimes we're pulled in so many directions. And it can be a challenge sometimes to really dedicate that time that is needed with that face-to-face visit. While it looks like you have 20 minutes on the schedule, that 20 minutes is not really a full 20 minutes often. And that's a big challenge for me. I think a challenge for the patients. Patients want to be heard. And when you are having all of these other demands and all of these other pulls, it can be difficult sometimes to really focus on the issue and the patient at hand.
Step into the shoes of the provider. Every patient's different. They can't anticipate what's on a patient's mind. So I've always felt that the providers were willing to answer the questions I had, but there were questions I should have had that I didn't think of. And again, the providers don't know what those are. So that's part of the challenge when you're dealing with a serious health issue that you weren't planning on and weren't prepared for.
Time management is a huge challenge. And I would say the biggest challenge right now is managing not so much the time when I'm one-on-one with my patients and families, but the after time when there are a lot of messages to address with our electronic health record. Patients have access to a portal where there's just, probably 30 messages a day that come in asking about results that they can now see on their own without their doctor being present. So it's generating a lot of extra time and interaction action that in order to manage that, I've just had to honestly block it out during my day because I need to be focused on the patient in front of me and the things we're discussing and, and just kind of block it out in order to be present. And that's what I do to get through the day in a way that feels right for me.
And I'm going to begin with you, Dr. Welther, because you practiced primary care for over 35 years. And in the video, you mentioned that pressures have increased with the use of electronic medical records. Can you tell us more about how documentation has impacted time for conversations with patients?
Well, what I was thinking about was describing how it used to be. And when I first started, we had paper charts, piles and walls of paper charts. But those paper charts were organized the way I wanted them to be. So I knew what was in it, I knew where it was, and it was my chart to organize. I dictated the office visits. So once the patient left, I dictated a short note, took it over. It was transcribed by someone else and pasted into the chart. And then I was finished with that visit as far as any other documentation. Over time, that got more complicated, more charts. Charts started getting thicker and thicker. Some patients, the charts weighed more than the patients. And obviously, EMR was supposed to be a benefit to help reduce some of the papers that were floating around and could get lost and get complicated. But what's happened is that the EMR has kind of taken on a life of its own. It records. There's a lot of things that are mandatorily have to be in the chart, and that is repeated each time someone is in. And if you pull up an office note, it's very long, and trying to find out relevant information in there can be difficult. People send me their old records from another doctor's office, and I get 200 pages, and to try to find one thing like an old colonoscopy from 10 years ago, it's just about impossible. It's almost worthless. There's benefits to EMR, and I think AI is going to have a impact on that, hopefully in a very positive way. And there are some early signs that it will be positive, but we don't know yet if there are going to be some negative consequences too. But there's so much that has to go into a chart, and then it's very hard to transmit that to another office and to have that other office transmit to us, but we're not on the same system. The hospital that we worked in had 3 systems of their own. They had a system in the emergency room, they had one in the hospital, and they had one in doctor's offices. They didn't talk to each other, and they didn't talk to mine. So you end up doing paper and then scanning it and faxing and all the other things that are just very time consuming. So it's not been an easy thing to do, and it was a very difficult transition to even get to an EMR. It was necessary, but I wish it could have been better done and a little bit more everybody on the same page, and it's just not that way.
Thank you. I'd like to turn to Colonel Baker. So as a patient, what have been the challenges you face with time to answer your questions and concerns?
Yeah, thank you, Bernie. Well, look, just listening to Dr. Welther, right? I think, first of all, I've taken the position since I was diagnosed with cancer in 2017 that the medical teams that I've dealt with, they have time restraints. And so over time, what I've been able to do, and it helps that my wife is a retired nurse to help advocate. I've learned that I've got to speak up, and I can't expect, and I think Kevin Daly said it in the lead-in, can't expect the provider to know what's on your mind. When you go through a cancer treatment, you start to really understand your body well, but you also have certain things that are going on with you. In my case, it was renal cancer. I have 1 kidney now. I have to pay attention to that. I want to make sure the doctor's paying attention to that. So I prepare myself to go in to meet with the doctor to make sure that I'm respectful of their time and that right up front, I can explain to them what my concerns are for that visit, be it physical or a follow-up or what the case may be. Now, with my oncologist, I'm on surveillance now, so my primary almost becomes more important at this point than my oncologist does because things are going fairly well there. So it's important to be prepared to do that, be respectful of the fact that you just heard Dr. Welter talk about it. The doctors are not, they're not thrilled with what the restraints they have on them now. So you have to be respectful of their time and be very targeted in your conversation with them in order to get the feedback from the doctor that's going to satisfy you and help you understand where you are with your medical care.
Good.
If I can just add that one of my colleagues once said that the complications and the treatments have evolved so much over the years that there's just so many other choices, so many things that we have to consider nowadays that weren't there 20 years, 30 years ago. So it just creates so much more complexity to the choices that physicians, providers have to consider and prioritize in terms of treatments, tests, referrals, things like that.
Yeah. So let me just turn to you, Jenny, because I'm really going to ask you the same question as I asked Jim Baker. What have been the challenges that you faced with time issues in communicating your questions and concerns to your providers?
Oh, thank you, Bernie. That's a good question for sure. I think one of the biggest challenges now for as a patient, we are able to access our portal very easily, and sometimes the results are in our portal before our team has even a chance to look at them. So I feel that, with the time management part, um, communicating to your doctor how you're going to approach things like that. I always reach out and tell Dr. Chamberlain, I know my PET scan is coming up. I know the results might be in there, but I'm not going to look at them. That's for time management for me is just being completely transparent with them. Just so they have a chance to look at them and let me know what's going on, understanding that they're also on a time schedule, being mindful of the time that they have to navigate their day with so many cancer patients. Just being, mindful of the time that they have, write your questions down, journal more. I feel like sometimes we lose focus very easily in the midst of a cancer diagnosis. And understanding that they are doing the best they can, but also reach out.
You bring up an important point, and we probably will come back to this, and that is information is already available in the portal,
Mhm.
which may be something you don't understand.
I don't.
Right? So,
Yeah.
you've made a decision that you're not going to go and look at that material right away, although it's very tempting, I'm sure, until your doctor has a chance to have reviewed it and then reach out to you. So that's another facet of one of the challenges these days, right?
Mhm.
So let me turn to you, Jess, because your practice is in cardiology, where you're treating patients with complex problems. So what have you found to be the biggest challenge with time limitations in your practice?
Yeah, so I think time limitations are not unique to any specific practice, but as Dr. Welther mentioned, as someone has more complex disease, those pressures on your time increase. And the thing that I've found as the biggest challenge is when I'm meeting someone for the first time. Right there is no way that I can, in 20 minutes, understand a lifetime of their health history. So I really try to, especially with those patients who I'm meeting for the first time, do my research and be as prepared as I can be walking into that visit to hopefully smooth that transition from what happened previously to how did you get here today. The other thing that I find, even with established patients, is there are things that I I need to know, right? I need to know if you're having issues on your blood thinners. I need to know if you're having chest pain, but I also need to know what your life is like. I need to know who's in your life. I need to know what's important to you. Because as Dr. Welter, and I think it actually came from Dr. Mastriani, had said there, the options for treatments are complex and they're continuing to evolve. And what we recommend and who we recommend it for is really based on who the person is, where they are in their life, and what they want to do. But how do you ask those questions, right? How do you get to the core of who someone is? That is not something we're ever taught in medical training.
Yeah, I mean, what we're talking about, everyone's really talking about, again, because it's really looking at the challenges for on both sides. And, and I have to say, there are no simple solutions to this, and I think that there are people, I think, who are in medicine and people who are patients and so forth, who just kind of throw up their hands in exasperation, right? And feel like, it can't be solved. There's nothing you really can do. But that's why we have this program this evening, because that's exactly what we're going to explore. Yes, we're going to talk about constraints, right? But there are things that can be done. So what I'd like to do now is turn our attention to what healthcare providers can do to meet these challenges. And we're going to begin, like we did before, with a video.
And I'm fortunate in that I work in a setting where if I run late, I can explain it and people understand. And I feel like the more people go through these interactions where they realize they may not be seeing us on time, but at least we're focused when we're there. That's kind of the key. Yesterday I had a long, a difficult conversation with a patient and I ended up running late. I didn't actually even realize it. I went in to see the next patient. She's standing there like she's about to walk out the door. And I said, "Oh, what time is it?" And I was 45 minutes late. And I said, "I am so sorry. I didn't even notice, let's shut the door. I'm so sorry to have made you wait." And by the end, she was like, "It was worth the wait. It's okay." But that's what happens. And I think patients are more forgiving for the most part, but everybody's frustrated with the way time management goes these days.
One of the things I've found that's really helped me provide quality care in my cardiology practice is doing a lot of homework upfront, making sure I'm aware of what is going on with a patient, both within our practice and whether or not they have seen other specialists, whether or not they've been referred to external providers for services, whether they've been in the ER, whether they've been hospitalized. Coming in with that knowledge really helps make the visit much more fluid. I'm not scrambling in that moment to get the information that I need to provide care. It also really helps the patient feel like they are being cared for in a way that centers around them. When you walk in and you tell a patient, "Oh, I saw you were in the ER last week with shortness of breath. Tell me a little bit more about that." They're usually positively surprised that you took the time to really go that extra step. And that 5 minutes it takes to do that work up front can oftentimes save you 10 or 15 minutes in the room and makes the interaction more positive overall.
The provider is always going to be under pressure. And, I don't see anything easing up on that. If anything, it's going to be more and more pressure on providers to see more patients. So the opportunity here is to have your time with the provider be very efficient and constructive, and that really can only happen if the patient is fully prepared.
One thing that would improve clinician satisfaction and the ability to care well for patients would be to spend less time in front of the screen and more time in front of patients. And I think some of that includes pre-visit planning, really using our ancillary members of the team to help kind of prep a chart, if you would. Make sure you have all the information that you need, all the reports that you have. And then also on the flip side, the one really exciting thing that's being more and more utilized is the ability to use AI scribes. So this allows you to do your charting or the paperwork piece of it with a much shorter time span. We have been using an AI scribe in the cardiology office. I have found it beneficial in terms of I can spend more time face to face with a patient. It prints out a very nice summary that the patient can take home in real time. So they're leaving the office with a sheet of paper that goes over what did we talk about and what were those instructions to help minimize confusion after the visit. And then for the clinician, it's really nice. It auto-populates a lot of the sections of your note for you, and it allows you to do more just editing rather than having to create the document yourself. So I think that is an exciting thing. I think there's always going to be demands on our time, but I think utilizing artificial intelligence, AI scribes, and really utilizing also our human resources in terms of our colleagues and the other care partners of the team to make sure that we're informed and we have the best information we can to help our patients in the room.
The goal is to prioritize, in my mind, what you want to accomplish. And again, looking at chronic medical conditions, if somebody's coming in with diabetes, you obviously want to know what their sugars are doing because that is an everyday thing, and that's something that they will often focus on. But you have to know where the kidney function is, heart function, and some of those things, what their blood pressure is. So the goal is to prioritize what is important, what do we need to get done today. We don't have to get it all done in one visit. If it's really complicated, then I usually will try to get them back in a relatively short period of time because we got to cover a lot of things. The problem with seeing people frequently is that creates more congestion on seeing other people. So chronic patients take up more time, partly because they have to be seen more frequently and they have complicated problems. So it's difficult, and you can't always get people in the time that you'd like to. But again, prioritizing issues is the best way that I've found to get through it. And the patient's input in that is crucial and is not always there.
So let's just expand on this. Obviously, we're really identifying the challenges, but trying to work towards what can you do within the framework that you have. So I'm going to start with you, Jess, because I'd like you to expand on what you said about improving workflow efficiency by preparing for visits before you see a patient. So, people may not be all that familiar with AI scribes. So, could you tell us a little bit more about your experience and how that works in your practice in caring for patients?
Yeah, absolutely. So, kind of like Dr. Welther had also discussed, when you have a complex patient or you have someone who has multiple medical issues, the first thing I like to do, and I actually block out a period of time in the morning to sit down and go through this with the medical office assistant who assists me. And that's to go through it. The electronic medical record has so much information out there, and just being able to cruise through it and say, okay, was there something that happened since the last time I saw this person? If so, is it pertinent to their care today? And if so, let's dive into that a little bit more. So that's kind of the stuff that happens on the front end, making sure I have the labs, I have all of their testing results, everything that I'm going to need for that day, and trying to get myself up to speed with what happened, within the last 6 months since I've seen them. And then the AI scribe is something that has been revolutionizing what's going on in the room and after you leave the room. So the way that our AI scribe works is it is an app on a smartphone, and that smartphone listens to the conversation between the patient and the provider. It is all HIPAA compliant. And then it will generate both information for the patient to take home, and that can pre-populate into a section that can be printed out and the patient can take home. And it will also populate the various sections of the chart that usually you have to type out with your interpretation of the conversation. And AI does a pretty good job at taking a conversation, distilling it down into the important parts, and allowing more time for the provider and allowing the patient to walk out with that information. So I found it beneficial. There certainly are limitations to it, in terms of formatting and not being able to pull everything from the EMR. But I think as this technology evolves, it really could be revolutionary in terms of a lot of those constraints on our time. And like I said, if AI could go through all that stuff that I'm doing on my own, and AI can help build my note afterwards, well, then that would give me so much more time in front with a patient to talk with them in real time about their concerns. And that's really the most important part of the visit.
Yeah, that's good. There's something there, a little bit, opportunity, right? To have more time with the time, back to the word time, with patients. So let me turn to Colonel Baker. Because in the video, we hear cardiology patient Kevin Daly describe the time pressures on doctors. We've been talking about it. But from your perspective, can you tell us how your oncology providers adjust to demands on their time to address the important issues for you?
Yeah, and as I said earlier, I'm in the surveillance stage now, but at the height of my cancer treatment for the 3 years, I was in a unique situation that I was on a trial. So I had a definite set team around me for the 2.5, 3 years that I was in the trial. And so they got to know us. And I think this goes back to what Jessica was saying is getting to know the patient. And so it came to the point where we learned to advocate for ourselves. And we had this unwritten understanding with the team that if we were reaching out for them, that it was something that needed to be answered. And it wasn't like there was this open discussion about it, but eventually it came to be an understanding. And it was a little bit different simply because I was on that trial. I mean, I had a baseline radiologist. I had the same oncologist. The nurses that were on the team were the same 3 nurses that are still there that we dealt with. So I had this unique situation where they knew enough to make time. But I did have some experiences at a large hospital, Sloan, where other parts of the medical team that operated outside of that trial needed to be heard from us, that they were not giving us the time that we needed to understand some of the side effects of the treatment that I was going under. I had some very serious side effects that required other doctors to deal with it. And it wasn't the same attentive type environment that I had within the trial framework. So we had to learn to advocate and have some hard conversations with those medical providers to understand that if we're reaching out to ask a question, we're not doing that because we just wanted to know. There's a real concern there. And I think the only way you get to that is an open conversation with the doctors. The other point I think is important, Bernie, is that I think as I listen and I talk to folks that are still active in the medical field, 2017, 18, 19, 20, when I was under treatment, the restraints are not what they are now. They've gotten worse. So it's even more important, and this applies to my primary more than my cancer care. It's even more important that there's a conversation and an understanding, and that you speak up about things that are going on so you can get the attention of the physician when you're with them to be able to deal with what your concerns are.
Yeah. So let me turn to you, Jenny. Since your 2018 diagnosis and treatment, you've had 3 recurrences. So you spent a lot of time receiving care. So please tell us what you've observed about the time pressure on your oncology team, and how have they made adjustments to meet your needs?
Thank you, Bernie. Yes, going through this 3 times, having a reoccurrence, I feel I think my experience with my oncology team, they they know because of my reoccurrences that I'm highly anxious. I put it that way. Just the having to advocate for things. To give you an example, when I had a reoccurrence, my most recent reoccurrence, I got in for the ultrasound and had the doctor tell me that the biopsy was pretty much going to be 8 weeks out, and that was not going to be okay. With this type of triple negative breast cancer, it's only 15% of all breast cancers. It's very aggressive. So I've learned to respectfully push back when I feel like something needs to be done. I communicate that with the doctors, and I've had great success with them following through, and also understanding that every case is different, right? Everyone's journey is different. And because of my reoccurrences, I think I have that, I'm flagged, so to speak, and they take it seriously. And I am so grateful for my team. I'm very, very lucky.
Yeah. Let me just turn now to Dr. Welter. And you recognize, as we all do, we should anyway, that doctors are not mind readers. And that patients coming in prepared, as you noted, can save precious time. So can you talk about patient input as a necessary component, think about time, in developing a patient-centered plan of care?
Well, as it's been mentioned, particularly Jessica, about how we are now pre-planning our visits and how we prep a chart before the day before a patient comes in, and the nurse goes over the chart, and we have the team approach to prepping for an office visit. I think patients need to pre-plan the visit as well. Patients walking in with no plan, it really makes it difficult because, again, we're trying to read their minds too, and we have our own agenda, our own prioritization of our goals. Would be really helpful to know what the patient's goals are and what their thoughts are. What do I want to accomplish with this visit today? We go into the grocery store and we don't just go in there and say, I'm just going to pick whatever I feel today. We go in with a grocery list, and that makes it more efficient and probably less costly. And we need the same thing from a patient. Some patients cannot do that. Some patients, it's just not either possible or it's just not in their mindset. And then we do the best we can. One thing I wanted to mention is something Jim was saying about he had continuity of his providers. I think continuity is extremely important. As Jessica said, when you don't have enough time to talk with the patient, you see him again and you build up a rapport with them over time where you get to know them bit by bit. And then that continuity really creates shortcuts to knowing where things are going and how to talk with them and communicate with them. But there's always a conflict between continuity and team. The bigger the team, the less continuity. So you kind of need a champion on your team who is kind of the go-to person who can kind of make sure that you get your questions answered. So patients have to advocate, as Jenny said, and again, it doesn't always happen, but it's important, and being prepared and having goals of their visit and communicating that clearly to their providers.
Yeah. You're talking about building relationships. Again, time factors are there, but how building a relationship, them getting to know you, can really make a difference in terms of the way they care for you, the time factor, right? The sense with Jenny, like an urgency, that I need to be taken care of, this biopsy right now. I can't wait. And then having known her and having a team know her could help facilitate that. So that's, again, one of those areas where there could be movement in terms of getting the best care, even though there are time restraints.
And if the patient, one of their goals is to get a closer relationship with their providers so they understand about their family, about their support system, about their psychological needs, that may not be something that the provider is going to be thinking on their priority list. So it has to be communicated. And again, you can't get to know somebody in one or two visits. It takes time, but little bit by little bit, it can make a big difference.
Yeah. So I'm going to take a question now that came in from one of the folks who's attending this program. And they ask, say, why is it that doctors have not banded together and demanded to have the system changed, as their first responsibility is to advocate for their patients? The strength and power they have could pressure hospitals to change, since doctors, as sources of revenue, have the power of the purse. Now that's a loaded question, but someone asked it, so I'm gonna put it out there.
Do you know the saying, herding cats? Doctors are not all on the same page, and they all have their own self-interests, and there's lots of financial pressures, political pressures. Yes, that would be ideal, but it's trying to get everybody on the same page. And at this point, there's no real clear way how you're going to be able to do that.
Yeah.
There have been some efforts to unionize. I know there was a group of urgent care physicians who did attempt to unionize to advocate for longer patient visits. But I think, like Dr. Welther said, some of the issue behind unionizing with physicians in particular is that with each specialty and each physician, the financial aspect, I think that's the concern, that a union's going to put us all on the same page. Nursing unions have done a really good job at doing that, right? That they've banded together and this is the maximum number of patients we care for per shift in the hospital. But physicians have never banded together to say, this is the maximum number of patients I can see safely in a day. And I'd be really curious to know some of the historical context as to why that has not happened. Interestingly, as a PA, we're kind of in between sometimes those two. And someone did reach out to me as a PA who said, do you think there would be interest in unionizing here to help give us more voice with the administration? I don't know that really took off, but there are some rumblings there. But that is historically how the United States labor force has addressed some of these things, is to band together with labor unions.
Yeah. Yeah.
I'll just add that
go ahead.
it's a decentralized system. Why do we have so many specialists and not enough primary care? Because there's no way of working that into the system. There's no process where there is a central planning for all that to create a better distribution of what kind of doctors there are, and then what kind of systems. Why do we have 100 different EMRs? It's too decentralized. That's probably the biggest answer.
Yeah, it still comes back to the patient and their providers.
Exactly.
That's what we're talking about. Because again, that's why I took that question, because it's like, oh my goodness. And then it's like, okay, yeah, it's something we could talk about, but what's most important and vital to this conversation is what you've been discussing so far. And so let me move on to the next video, which is, there's not enough time. What can patients do about it? So let's take a look.
Providers are under a lot of pressure to see more patients. Many practices have waiting lists or are closed. And so the general public and the administration are looking to have more patients seen. So there's a lot of pressure coupled with the fact that the providers have so much other documentation to do when they're not seeing patients. I've talked to many providers and they wish they could do nothing but see patients, but that's just not the reality. So if the administrative side of healthcare could adopt a mechanism somehow to educate patients to understand more about what they're about to undergo, so that they can be better prepared when they do have FaceTime with the provider to ask the questions that they should be asking and to get those answers, which would make the FaceTime interaction with the provider very efficient. And that's probably one opportunity that healthcare system could pursue.
If patients feel there's not enough time to address their questions or concerns, the piece of advice I would give them is think about the things that are important to you going into your visit. Think about what are the one or two things that are the most important that you have addressed. What are the big questions that you have? And it's okay to write them down. If we don't get to them all, you can always reach out via email or via the portals to maybe answer some of those other questions. Coming in prepared, though, helps patients articulate their concerns in a better way that gets their question or the issue that they want addressed to come across better, and helps us as the clinicians figure out what is important to the patient, what do we need to be addressing in this visit, and if there are additional things, making sure that we give those patients the opportunity and the resources to address those in other ways, or maybe make a shorter follow-up so that we can address those less urgent concerns.
I do feel like they have to be their own advocate and say, you know, this wasn't enough time. I have a lot more questions, and schedule another appointment. Or I think hospitals, and this kind of addresses the next question, I think, but hospitals can do better at creating more resources for those questions. Patient advocates, a stronger frontline system of nurses and experienced social workers and experienced caregivers to address those concerns. Right now, that frontline crew is at a skeleton of what it once was. And so everything rolls back down onto our desk and onto our 20-minute appointment. And that's where the frustration comes. So they have to be their own advocate and ask for more time. And that's all I would recommend.
The nice thing that I've learned with Speak Sooner is that the guidebook prompts patients ahead of time. Anything that gets patients thinking ahead of time what they want to accomplish in the visit is immense. It creates their priority list to then something I can look at with my priority list, and we can put it together and we can actually get a more efficient visit. The medical assistant will again see them before I will, and we'll try to go over that with the patient. And if the patient hasn't really thought about it, maybe that will again start to prompt them to think about what is important to them in this visit.
You can cover a lot in 15 minutes if you know the questions to ask, you know, and that's where I see there's an opportunity to educate patients beforehand.
Okay. Again, we keep on coming back to the relationship between the medical providers and the patients. But I want to turn to Jenny, to you first, because we just heard actually cardiology patient Kevin Daly just now, and your oncologist, Dr. Mary Chamberlain, emphasized the importance of patients advocating for themselves. Not saying this is easy, we know, but taking the lead in asking questions. And you alluded a little earlier to really learning to advocate for yourself.
Yes.
So my question, it really turns to, so at what point did you understand in this arc of your treatments, right, the importance of opening these difficult conversations, and how did your doctors and nurses respond?
Another great question. I think advocating, you know, not being afraid, I guess being brave, right? Ask the questions that you need to, the pushback a little bit. And also, you know, to give you an example about palliative care, when I was first brought up that option, I'm thinking, wait, why are we even talking about this? But there's two different things. Like there's palliative care to help, you know, get the patient through the side effects of what chemo might be doing. Your doctor is not going to know unless you advocate for yourself and saying, this is what I'm experiencing. For me, journaling was super helpful. So when I had the questions, I could address those questions with Dr. Chamberlain and the team, and just, you know, not being afraid to push back a little bit and say, what is our treatment plan, or what does this look like to you? So the patient can understand. It's a very scary place to be. And sometimes we don't think about the right questions to ask when we're there. especially when there's scans involved, right? You know the results are coming. It's the looming part of it. And just being completely transparent with your care team and not I guess honor yourself and make it clear to them where you're at.
You bring up a point because there can be a hesitancy, and probably often is, to ask questions or appear more aggressive
Right.
about the things that matter to you, and being, hesitant or fearful of offending your doctor, and yet what you're talking about, everybody is talking about, is it's really critical to be able to advocate for yourselves. And granted, it's nice to say I'm not questioning your your knowledge, but this is really, as you're saying, this is important to me. I really want more information about palliative care. I'm having these symptoms, and I really want to know, can they be alleviated?
Mhm.
So it really, and that's why it's like this program. It's like opening it up and being transparent. That it's not always comfortable to say these things, but it's really essential, especially now with these time restraints, to really get to it, early in the conversation. So let me just turn to Jim along these lines, because you were treated, as you said, at Memorial Sloan Kettering, which is a very large hospital in New York City, cancer hospital. So can you tell us about your experience communicating with doctors and nurses, and was there a point at which that you recognized that you needed to take a more active role in advocating for yourself and asking difficult questions?
Yeah, I just want to make an observation for a minute about Speak Sooner, right? As I'm listening to this, it's just like for me, and Jenny, bless you, about the challenges you've had that you've learned along the way. I think about the folks that don't have our experiences, Bernie, about teaching them to be able to do exactly what you're saying, right? So I just want to make that observation about how important it is to teach people to be able to ask questions and communicate. I come from a generation where, doctors were kind of up on a pedestal, and there was this power differential between the doctor and the patient, and getting over that can be very difficult. In my case, you specifically asked about Sloan. It's intimidating going to a location like that. I was very lucky right off the bat. The doctor that came into my life, it's been in my life. I was blessed that it was who it was because of his personality, because he made it really clear, really quick, early on, that I was in serious trouble and that I didn't have a lot of time to make decisions about the surgery to remove my kidney, to take the mass tumor off the kidney. It had metastasized to my lungs. And he walked us through very clearly exactly what was going to happen. That sobered me up in a hurry. I mean, I knew, I got diagnosed with cancer. I knew that it was serious, but he sobered us up in a real hurry about just what our options were. And we immediately at that point made a pact between my wife and I that we were going to do everything in our power to live a very long time. And so we started advocating very early on. But in my situation, again, not to be repetitive, the team that was around me made that really easy. It's outside of that team and then coming back to Vermont, where I mentioned this earlier, I'm on my 5th primary in 3 years. And so going back to what the other conversations were, I just recently had a physical with yet my new primary. And as soon as she walked in the door, I said, could you just sit down for a minute? Because I want to tell you my story. I know you have very limited time. I want to respect that time, but there's certain things you need to know about me that are very important. I would not have been able to do that 10 years ago. I would have walked in there, sat there, quiet, like a meek mouse, waiting for her to talk to me. And I think when you face the reality of your illness, you learn very quickly that you've got to advocate for yourself. And that's now carried over to make sure that my new primary hopefully it's my primary for a while, my new primary understands the complication of me, and I'm aware. And Jenny, we were talking before about knowing your body, right? Like
Yeah.
knowing your body, I know my body now. And so I made that very clear to my primary that if I call you up and I tell you there's something going on, that I'm aware of what's happening with my body. And that's important to me that I get a response to that.
Mm-hmm.
So I know that's a lot of information I just gave, but learning to be able to speak up. And I think my final point here is going back to my original point. I think about people that haven't had that much exposure to the system and what Kevin Daly was talking about, and the question you got, Bernie, about doctors banding together. The healthcare system today is so complicated and under such pressure, just not the doctors, the entire systems financially, that I worry about empathy fatigue with providers. And so you have to be able to respect the pressure they're under, but balance that with what your needs are.
Yeah. Again, it keeps on coming back to the system itself is so overwhelming, and it's what you can influence, and the providers, healthcare providers can influence is what happens in the room. But it's about, and Jess uses the word, getting on the same page. So let me turn to you, Jess, because you talked about encouraging patients to write their questions down before the visit, so you can prioritize what's going on in their minds in 15 to 20 minutes. Okay, so let me ask you this: what do you say when there's not enough time? I think you touched on it before. And how have your patients responded when there's not enough time?
Yeah, I think that's always a really difficult one. And the first kind of question I ask myself is this something, you have your hand on the door and they say something, and if they are a coronary artery disease patient who had bypass surgery and say, oh, by the way, and I've been having chest pain, that is that you take the hand off the door and you sit back down and you say, okay, tell me more about this. And you just accept that you're going to be late. But if the hand is on the door and they say, oh, I had some questions about, how exactly, like, how is it going to benefit me if my LDL goes 20 points lower? Well, that might be something. And what I've said to them before is I said, you know what? I'm not exactly sure. Let me take a look at the literature. There isn't a whole lot out about, not using a statin for secondary prevention after you've had a heart attack. Most of the studies, someone's on a statin, but I'll do some research on this and I'll get back to you in a few days. And generally people understand that. But again, it comes back to that relationship, right? They have to trust that I'm going to take my hand off the door and sit down when there is something that needs to be addressed, and they are having a concern that needs to be addressed right then and there. If you don't have that relationship, I think that is when that can sour that I'm going to leave this for another day. If you know them and they know you, and you know that that you as the provider are going to take them as the patient seriously when they have a concern that can't wait, great. Then when there is a concern that can wait, they're much more accepting about that. And I think that has to be something that's built over time, but that type of relationship can be quickened by people being really honest and open with each other. Some of the best relationships I have are with patients who I'll recommend something and they say, I don't think so. I don't think that's for me. Because then I trust that they're going to also tell me when something's not right for them. And I'm hearing, whether it's Colonel Baker or Jenny talking about fear and anxiety. And really that is the responsibility for us as your provider to create an environment that is more welcoming to all kinds of questions, all kinds of comments, right? If something doesn't feel right for you, you should feel very comfortable bringing that up, right? This whole visit's about you. It's not about me. It's about you. And the Speak Sooner's program, honestly, has really helped me as a provider, I think, phrase things in a certain way, and whether it's verbal or whether it's nonverbal, but creating a better environment or a way in which I'm asking questions or interacting with a patient that seems to elicit a better response, a more honest response, more truthful response. And that, I know this is kind of getting away from your initial question, but I think it really gets to the heart of it is, right, we have to set the stage. And whether that's, back in the day, it used to be you saw your same primary care provider for 30 years, so that fear was gone. Now, when you're seeing your third primary care provider in 2 years, how do you set that stage? How do you build that rapport? How do you build that relationship with someone more quickly so that you can get to that same point where they hear my concerns, they take me seriously, they know it's important to me? And part of that is learning just how to communicate better. And I think that that's what we can do in the room with each other, provider and patient, is finding better ways to communicate. And I think a lot of that starts with the provider.
Great, because that actually segues into what I was going to ask Dr. Welter, because in the video, you talked again about time limitations and having patients prioritize their concerns, and you do the same, and you compare notes and things like that. And then you reference the Speak Sooner guide. And, some people who are attending may know something about this. They may not, and just mention that. So if you could just take a moment and explain how that Speak Sooner guide works and the program around it.
Well, the Speak Sooner guide started as a guidebook of questions and had chapters in that patients could think about it and write out their thoughts, and then communicate that to the physicians. A couple, 2-3 years ago, we took that process to Adirondack Health Oncology Department, and they actually incorporated into their process. So it's almost like the guidebook has now evolved into a process where each member of the team knows the same questions and prompts patients to ask the same questions to, again, get the patients to start thinking about what they really are thinking and feeling. That may not be something that's automatically something that comes into their head. And by having that done at every level of the process, those things can then be uploaded, if you will, to the nurse practitioner or the physician as far as something that is really, really important to those patients that might not otherwise come up. Maybe it's a family member that is concerned about taking care of them if they deteriorate, and that may not be something that comes straight out in an office visit. Maybe childcare, maybe other things that are important to that patient, but are just not something that's going to be automatically in the physician's mind. So it's getting those things ahead, thought about and communicated ahead of time, then communicated to the people involved. And as I said at the beginning, it really makes the office visit more efficient because we're getting to the guts of the needs right at the beginning. And everybody's hopefully going to be more or less on the same page. If physicians talking about treatments and the patients are worried about their lifestyle and they can't get those two things together, both are going to be unhappy with the visit and feeling like they're not getting their needs met. The other thing I was thinking about is with advocacy is that advocacy is really about attention. And what you're trying to do is get the provider's attention and trying to get their focus on what you want or what you need. So we have all things swimming in our heads too about what we want to do and where things are going and what we have to treat with. We need to focus, and we need to know where that focus needs to go. And then we're asking the patients to focus and tell us what their needs are.
Thank you. That's great. I want to just turn now, because again, we've been talking about administration, hospitals, this and that, and what can we expect of them in all this? And we kind of touched upon it to some degree. It's overwhelming. It's so complex. But in the video, Kevin Daly, who is a patient, but he's also a former hospital administrator, and he talked about, as we all actually have today, about an overburdened healthcare system, right? Short-staffed, pressure to see more patients, as Kevin talked about. And he also believes he doesn't think this is going to change. And it may even, and probably likely, will get worse. And now we're talking about federal spending cuts. So, it's very present. So I'd like to ask you, what do you say? What do patients and their providers say to one another, right, around this issue of time pressure? We've been talking about it, but what do you think they should be saying to one another when they're in the room about these increasing time pressures? What are your thoughts?
Bernie, I think I touched on this earlier, right? And I think Jessica brought this up about, the relationship with the doctor is about trust. Patient trusting the doctor having trust in the patient that they're communicating what their needs are. I think there's nothing wrong with just saying that, especially if you're meeting a doctor for the first time, or even not the first time, but you're not familiar with them. I think it also applies to one of my frustrations is going to the doctor's office, and some of this is being spoiled for my cancer treatment. Like the people that check me in, I never see the same face. So having that really clear, quick understanding, I understand what you're under for pressure, doctor. I think I told you this story, Bernie, over coffee, right? When I went to meet the doctor, she came in, besides asking her to sit down for a minute, saying, look, I know you only have 15 minutes, recognizing, giving her the recognition that she only has 15 minutes, right? I think that's part of the conversation to have. You give some respect and value to what they're up against as well.
Yeah. So from a provider standpoint, what would you say, again, addressing the pressures, setting the tone, how would you go about communicating that to patients, knowing what that you have the 15 to 20 minutes and that's basically it. So how do you set that tone? What do you say to your patients?
I'm probably not the best at this, which is why I generally run late. But, I do think it's difficult, right? Because if you go in and you say, I only have 15 minutes with you, that can kind of set it sets a bad feeling sometimes, even though that's the reality, right? So oftentimes I go in and I'll say, I'll try to just focus more. I'll say, have you been concerned about anything with your heart since last visit? And just try to focus the visit a little bit more on relevant topics at hand. And I do. I go in and I say, how have you been doing since last visit? And most of my patients by now that know me know that that's my opening to say, hey, if you have something on your mind that you want to talk about, let's bring it up right now in the first 5 seconds when we walk in the door. And then I usually do try to leave the last 3 minutes to 5 minutes at the end to say, do you have any questions or concerns? And then I pause. I don't move. I don't start typing. I just stay silent, because the power of silence, I found 5 seconds of silence. If someone does have a question, 5 seconds of silence will bring that out.
Good. That's good. That's really good that you don't, preface everything by saying, we only have 15, 20 minutes. It's like you're doing it in a way like what's on your mind, and making the space for that is, because the fact of the matter is patients know that. They know that already. So that's a very nice way of going about it. But again, it's back to the relationship, and it's back to the communication. And Jim saying that, right up front, saying, "I know, Doc, you don't have much. You only have so much time." It's being recognized that the communication really needs to be a two-way street. It needs to go back and forth, recognizing each person's position at the time when you're sitting in that room. And that's that. I think you used the term empathy. You think you said empathy fatigue, and I suspect that empathy plays another role in this. And it could generate actually some energy and some positivity between the patient and the provider at the time by just recognizing one another's situation. So I'm aware of our time, and I appreciated that. Dr. Welter talked about the Speak Sooner program at Adirondack Health Oncology, because in many ways that's success story because, and as I said at the very beginning, we can throw our hands up and say, there's nothing can be done. And you touched upon it, Mike, but I'd just like to tell a little bit more because what it has really proven is that the Speak Sooner Guide is really the centerpiece of the program in the oncology department up there, because it's wrapped around the program where the guide is referenced, the topics of the guide are referenced when patients come in. And what it's actually done, and over 3 years now, it's actually back to prompting patients. They're prepared to really talk about what they have questions regarding their diagnosis, their prognosis, treatment plan, psychosocial needs, as you mentioned, and that each time the patient comes in, these issues, these concerns, these questions are referenced. So it's ongoing, and it doesn't take much time. Something else we learned. We thought, oh, this is, introducing the guy is going to take a lot. No, it doesn't. It takes a few minutes, and the result of that, not only in terms of patient satisfaction and helping patient really become part of planning of care, the other part that we've learned is that it's having that program, the Speak Sooner program, has actually improved communication between the nurses, the social worker, the oncologist, nurse practitioner about the concerns of the patients, right? And it's led to more efficiencies. You touched upon this, Dr. Welter, efficiencies in workflow and increased job satisfaction. So we're talking about, like what's possible. And I'm not saying Speak Sooner is the be all end all, but it really is an example. And you're talking about it today. It's an example of what can be done. And in fact, the administration is supportive of this, And so, as much as we have limitations, there are possibilities. It's about taking steps to try to do some new and novel programs, which turn out to be very simple and actually can have an impact on provider burnout. Because with greater job satisfaction, there's less likely there'll be provider burnout. And if anyone is keeping up with the news, the number of people who are leaving medicine at all levels is really significant. So things can be done. And in essence, and you're using some of the Speak Sooner in your department, your cardiology, And so, yes, we do see the opportunity for Speak Sooner to be implemented in all aspects of healthcare, all departments. So we could talk lots about that. And I know, again, I'm the one who's supposed to be aware of time here, and I am, and we're really running very close. So what I'd like to do is just simple to ask each one of you, like, if you had one suggestion to improve time efficiency while maintaining quality of care, what would it be? One suggestion.
Revisit planning on both sides.
Mm-hmm. I have to second that for sure. Yes. Be prepared as much as you can to make that appointment as efficient as it can be.
Yeah, educate yourself about what the healthcare system is, the pressure it's under, so you're better prepared when you meet with your physician.
It's the same theme, and I hope that those who are attending and those who will really watch the recording will take in your experience, your perspective, and ultimately your wisdom because of what you have learned working within a system that is getting more and more difficult to navigate. And that yet there are these possibilities, but it takes what you're saying about being prepared on both sides. And that's really word to the wise for anyone who's on either side, whether you're a provider or you're a patient, or for that matter, a family member.
Can I just add to what you were saying about Speak Sooner? I think Kevin Daly had mentioned how it's only going to get worse. I think we're all aware that it's probably only going to get worse financially, time, and all the other things. AI might be a real benefit, but it's a little bit too early to tell. I think the Speak Sooner system, as you said, potentially can improve patient satisfaction, provider satisfaction, maybe help with keeping physicians on board or retaining them. We have some preliminary information from Adirondack Health that might actually be saving money because they had fewer hospital admissions. That's all a positive cycle that if we could continue to press and work into the whole system, it can only help. I mean, the way things are going is in a very negative cycle. So we're hoping that we can push this along.
Well, yes, absolutely. And I just want to let people know that the Speak Sooner guide is free online at speaksooner.org. So anyone can access it. And yes, there are print copies, and there, you can purchase them as well by going to speaksooner.org. But the guide is free. And it's, as I say, it's not the be all end all, because it's like you're saying, be prepared. You can write your own questions. You don't have to have the guide. But yet, what we now know is the guide has been proven to be effective to help people prepare for their visits, and it helps the patient, and it helps the provider. So, again, if you want just to view it, you can see it at speaksooner.org. And I'd like to thank the panel again for your perspective, your wisdom, and also those who are behind the scenes. As you can see, Mike Cutler, Meg Cottam, Leslie Noyes, and Louise Payton. You don't see them, but they are really they're essential in us being able to do this, especially when you talk about technology, which we had a blip at the very beginning. Unfortunately, it didn't happen later on during our program. So there's the guide. You can see it. Again, you'll find that online at speaksooner.org. And I also just want to leave you with one final thought, and that is, we've heard this evening from all you on the panel that effective communication is not soft or inconsequential. In fact, it's an essential component to being able to make decisions about care that align with a person's values, preferences, and goals. And you heard that actually this evening. And it could also lead, as Dr. Welter mentions, to efficiencies in healthcare delivery, including time management. So with that, I would really like to say to all of you on behalf of the Center for Communication and Medicine, I'd like to thank you for attending. We look forward to seeing you again at our next Speak Sooner Community Education Program. And also, if you know folks who were not able to attend, just remind them that they can go to speaksooner.org, put in your email, and you will be notified when the recording is available. And it will be there for anyone who could really benefit from that. So again, I'd like to thank our panel and thank you for attending. And I wish all of you a very good evening.